we're out of February and into March now, into the month where there is still so much cold among people, and they are the noses are running and they are coughing. And since I read a very interesting article today about cardiac disease and the connection to colds, I want to stay with the subject of taking care of your heart for one more time. And I'm going to refer to this interview that I read because it was so good and it has all those answers that I want you to know. You know, I always talk about that the body wants regular sleep, it wants regular food, and it wants regular exercise. That is to feel good and to lower the stress, the everyday stress, and that is a good way to keep the stress out of your life, or at least an arm's length away. But when you get a cold, it does get a little bit different with the advice I would give you, because there is something between the cold and the heart that I want to talk about. So I read this very interesting article, and I'm going to read the points from it so that I don't miss anything, so that you get whatever you need to know. You know, when you are having a temperature and you really feel bad, then the body does not really want to have exercise, right? That kind of is obvious to anybody. But there are so many people that start training right after they get out of bed and think that they are going to train themselves much faster to become healthy again. And they're wrong, because you can't do it. It doesn't really work that way. It's out of the biology, so to speak. So I want to read the answers and the questions and the answers from this Mr. Julin at the hospital in where I live here in Lund, or in Malmö rather. But it's the same. It's a cooperation hospital. So the first question he asks is, can you train and exercise when you have a cold and feel down? Down that way when you have a cold. And he says no. And there are actually experiments where they have seen at least around I think it was some kind of animal, that the viruses spread so much faster in your body if you train, so you worsen the cold rather than making it better. So for that reason, you shouldn't exercise when you have a cold. And the next question was, what symptom do you mostly need to take in consideration? And that is, of course, the fever. If you have a fever, it's a no-no to do physical activity. And what can happen if you the third question is, what can happen if you don't listen to the body's signals? Well, worst case scenario, these viruses can affect the heart muscle and make an inflammation in there. And the worst case scenario of those who get it, 20% die. So it's really it is really a risk. And of course, when you do these studies, you can see there are people, there are sportsmen, and they take more risks, and they are into these numbers too. So of course, for the everyday person, maybe the personal risk is not that high, but there is still a big risk. You are not supposed to exercise or do competition with an infection in your body. So is it only the heart that can be damaged is the next question. And like I said before, no, you also risk, the second risk is that you worsen your infection. And wouldn't it be better to try to get healthy again instead of trying to worsen it by doing it? And the next question is if we're differently susceptible to this kind of complications, and actually they don't really know. And we know that some sportsmen do get more problems, but they also exercise much more, so it's absolutely very difficult to say. And the sixth question is what symptoms can you have when you continue to exercise or do at least some more slighter exercise. And that is when the fever is going down or getting off you, and you can start taking walks, slow stuff. But you should not do anything that is pulse increasing, nothing at all. So the next question was if you could instead do weightlifting, and that is also pulse increasing, so that's also not really recommended. And then they talk about lighter exercise, like you can do some kinds of yoga. You don't it's not that tough in that sense, and that might be okay depending on how you feel, and also how fast after you have your infection can you start. And he says absolutely you have to be no fever at all, but he would say that he himself would not exercise until he feels well, and that might take even a couple of weeks, because you have this cough and you have a running nose and all that takes a few days, and you worsen it if you do too much. So the less you do for a short time, the faster you will get healthy again, and then you can start exercising in your normal way again. And if it's okay to take pills and nose nose sprays and stuff, and then the fever and whatever goes away for a moment, if that is okay to use. And no, because you're just cheating yourself, you're cheating your own body if you do that. That's how it is. And then he asked what is the most misunderstood thing about exercise and colds, and he says what most people believe is that you can exercise your cold away, and that is, like you understand from what I've told you now, absolutely not possible. You're just doing yourself a disservice. So I just wanted to share these wise words from this cardiologist. So I hope you take care, and I hope you don't get that cold so much often. And if you have friends who would need this, then feel free to share this link with them. Bye.